The Jal Jeevan mission has reached 14 crore rural households and 72% of the rural households have been installed with clean water drinking taps. I am joined by Vikas Sheel, Senior IS Officer, Mission Director of Jal Jeevan Mission. Sir, first of all, welcome to India today. Sir, you have reached around more than 70% rural households with clean drinking water. So, sir, what is the significance of this mission on the ground, sir?
Yeah, so first of all, thank you very much for having me, giving me this opportunity to share my views. I'm indeed very happy to share that the Jal Jeevan mission recently achieved the milestone of providing 14 crore tap water connections to rural households. At the start of the mission, only 3 crore 23 lakh households had tap water, which is only about 17%. Now more than 72, almost 73% rural households are having tap water in their homes. In terms of the significance, I can only say that this achievement is unparalleled. We've been working with unprecedented speed and at an unimaginable scale. In a short span of 4 years, almost more than 10 crore 80 lakh connections have been provided. In the last calendar year, since the 1st of January 23, we've been providing one tap connection on an average every second in the country, and this pace is still being maintained. So very happy to be able to contribute to this effort, and tap water brings a lot of difference to the lives of people in the homes where this is a new facility, and the mission is incessantly working towards achieving saturation to all rural households.
So when the mission started, it was 3 crore household. Now you have reached to the 14 crore number. So what were the challenges the mission faced while this last 4 years from starting to the now?
Yeah, so apart from limited capacities in the states for implementation of such large number of schemes and projects, limited capacities in the contractors, implementation agencies, we also had the challenges of the COVID-19 pandemic, due to which we saw disruptions in progress. There was also the Russia-Ukraine conflict, because of which the prices of metals rose abruptly, and that led to some disruption in implementation of the schemes, because a substantial part of the materials that are used in the schemes, in the pipe water supply schemes, is metal pipes and plastic pipes. But despite all these challenges, the states have made remarkable progress to be where we are today.
Sir, which are the states which have made the remarkable, you're saying, goal? They have achieved the goal. They have achieved single digit to double digit goal of getting taps to the rural households.
Yeah. So at the time of the start of the mission, as I said, at the national level we had only 17% coverage. But if you look at the states, there were many states which were at 2%, 3%, and even less than 1%. Today, I'm happy to share that there is no state in the country with less than 40% coverage. There are only 3 states with less than 50% coverage. And all states have made remarkable progress in terms of coming to a point where they are today, from as compared to where they were in 2019. Yeah.
Sir, as the mission has achieved a goal of 72 and now it will be going to 100%, sir. Sir, but what about operations and maintenance of the taps and the drinking water facilities?
Yeah, so the Jal Jeevan mission provides assistance to states and UTs for creation of these capital assets, these pipe water supply schemes. Drinking water being a state subject, the responsibility for making sure that these schemes are properly operated and maintained and managed will lie with the respective state governments, and therefore what we are doing is we are pursuing with the states to make sure that adequate finance is made available for operation and maintenance. The Government of India has, through the 15th Finance Commission, provisioned substantial amount of funds for the panchayats and pani samitis to be able to bear the expenses of operations. Some of it will come from the user charges that the pani samitis or panchayats will levy, collect and then utilize. But we are impressing on states that the states will have to have an O&M policy in place to make sure that there are no gaps in financing, and therefore the schemes that are being created remain functional. The other aspect is in terms of the capacity for repairs, etc. For minor repairs, it will be important that the capacities or availability of skilled manpower is ensured at the local level, and therefore in partnership with the Ministry of Skill Development, our department has launched a new scheme called Nal Jal Mitra. Under the Nal Jal Mitra scheme, it is envisaged that in every panchayat we will train one person, will multi-skill this person, and so that a person is available at the local level, knowing the necessary skill of plumbing, masonry, a bit of electrical work, so that any small disruption or breakdown that happens in the pipe water supply scheme can be repaired immediately by this person who is locally available. We are implementing this, empowering the panchayats to select, nominate, finance the training, etc. And almost all states are now poised to start these trainings. So with those are the 2-3 main thrust areas from our side in terms of helping states to make sure that the schemes are properly operated and maintained.
Sir, as the water has reached, the tap has reached to the household, sir, what about water quality?
Yeah, so we have made significant progress in water quality also. At the start of Jal Jeevan mission, there were around 16,000 habitations where people had no option but to drink water affected with arsenic or fluoride, leading to various kinds of health problems. Now I am happy to share that all these habitations, provision of clean drinking water has been made. Similarly, to create confidence about water quality among people, we have also trained more than 23 lakh women in rural areas for use of field testing kits for testing water quality locally at the tap level. These women undertake water quality testing. They demonstrate the quality of water to the people to create confidence in the quality of water being supplied through taps. There are a few habitations where work still remains to be done, and these habitations are affected with iron, salinity, etc. But there also works are progressing at a rapid pace, and we are sure that soon any kind of issue related to water supply water quality being affected will not be there.
So how Jal Jeevan mission has impacted on the ground for employment and for the health services?
Yeah, so there are some recent publications by renowned international organizations. The WHO has estimated that saturation of tap water in the country would lead to prevention of almost 4 lakh diarrheal deaths. This, when converted to standards of disability adjusted life years or DALYs, and then converted to its economic value, yields an economic saving of around 8.5 lakh crores for the country. And this is only on account of diarrheal deaths. There are other diseases and the morbidity related to diarrhea, which is not factored in this estimate, and therefore the actual impact is much more. Similarly, in terms of health, Professor Michael Kramer, who is a Nobel laureate, has estimated that saturation under the JJM would lead to around 30% reduction in child mortality. That is the number of children who die before achieving the age of 5 years is likely to reduce by 1,36,000 every year. So there is a significant health impact. There is an impact on ease of living. So people have to spend a lot of time in collection of water in absence of taps. It is estimated by the WHO that almost 5.5 crore hours are spent in collection of water on a daily basis by people in India, in rural India. All this time will be saved with provision of tap water, and this time can then be utilized for other economic activities by the households. In terms of employment, again, IIM Bangalore in partnership with the International Labour Organization has estimated that during the construction phase of Jal Jeevan Mission, almost 2.8 crore person years of employment will be generated. And for the operation and maintenance of these schemes that are being created, around 13.5 lakh people will be employed every year for the times to come. So these are some of the impacts that have so far been studied and published. There are other impacts which I am sure in due course of time various research agencies will study and publish.
Sir, what lies ahead for the Jal Jeevan Mission in future?
Yeah, so our first priority is to make sure that all the remaining around 5 crore 20 lakh odd households are also covered as soon as possible. At the moment, 9 states in the country are such that they have 100% coverage. They are Har Ghar Jal states. Some of the states have already crossed 90%. And the remaining states are rapidly progressing towards achieving saturation. So that is our first priority. The other priority is to make sure that some of the areas where water quality is still an issue, those areas are also, those issues are also addressed. Then, as I said, implementation of Nal Jal Mitra program to create local trained capacities for operations and maintenance. And a whole lot of initiative to build confidence among people about the quality of water, so that just as we see in urban areas, there is very little confidence in water quality, and you will find that people will use RO systems almost everywhere. We don't want that to happen to the rural areas. So we are taking steps that we should inform people about the water quality and keep on building confidence of the community, so that and in that process we also end up monitoring water quality, because all the impacts that I have said, health impacts especially, will be realized only if water quality is there.
Sir, any other thing you want to add, any message to our audience?
Yeah, so as we keep on increasing tap water coverage, my only appeal would be that with the provision of tap water, we must still understand that water is a precious finite resource, and therefore water should be utilized efficiently. We should reduce water wastage while utilizing water, and we should keep on working on conservation of water sources, so that the schemes that have been designed based on certain assumptions about the water sources, that the source is going to last 20 years, 25 years, 30 years, those sources do last that long. And for that, the houses, the homes where the water is being supplied, water will have to be utilized judiciously, and all of us, the government, the state governments, the civil society and the people will have to keep on working for conservation of water and water sources.
Thank you for talking, sir.
Thank you.
As we have heard from Vikas Sheel, Mission Director, Jal Jeevan Mission, that how tapped water has reached to 14 crore household in rural India, and how this mission will progress in the future. He also talked about the Mitra program. He also talked about to conserve the water, because the water has reached to your home, but now it's your duty to conserve it. With cameraman Madan, it's Anmol Nagpali from New Delhi.